Common mistakes that may cause heartworms to infect your animal. One of the diseases that affect dogs and cats, and the most common, heartworm disease, which is a disease that has increased in spread in the recent period, as the carrier of this disease is transmitted from one animal to another, through insects that bite the affected animal, and transfer it to another animal. And although this disease is one of the diseases that are easy to deal with by veterinarians, it is difficult and expensive to treat, as there are 61% of cases still difficult to cure, according to the report of the American Heartworms Association. To protect your pet, you have to move away from some common mistakes in heartworm prevention, as you can make sure your pet is properly protected. 1. Failure to conduct annual periodic checks. Before giving your pet any medicine to prevent heartworm disease, you must make sure that your pet is not really infected with this disease. First, go with it to the veterinarian and do a blood test for him, and make sure he is safe from this disease, and then start giving him preventive medicine. And to alert you if you give doses of heartworm prevention medicine to your pet, and this animal is already infected with these worms will die because of the medicine that you gave the animal, but they will accumulate around the heart and lungs, causing a health crisis for your pet that may sometimes reach death. 2. Treatment is limited to seasonal doses only. Pet keepers are interested in prevention measures in the summer season only because of the abundance of insects, more than before due to the noticeable rise in temperatures and the length of the summer period than before, but this exposes the animal to infection also in the fall and winter seasons. 3. Do not pay attention to the weight of the animal. It is important to know that the doses for prevention of this disease differ according to the weight of the animal, and unfortunately many people are ignorant of this, which makes them give their animals the same doses that they used to give them in the past, and with the difference in the weight of the animal by increase or decrease, it will not get the desired result. So you must follow the weight of the animal is with the veterinarian, and the dose of preventive medicine changes according to the animal's weight. 4. Ignorance of the types of medicines. Some pet owners are ignorant of the types of preventive medicines from heartworm disease, and some have tried a medicine that did not work with their pet, so it left it without protection. So you should consult your veterinarian to find out what type of medicine is appropriate for your animal. Where the doctor determines the type of medicine by weighing your pet. There are medicines that are taken by mouth, there are injections that are taken every 6 months, and there are other types that are localized, and you should know, dear reader, that medicines that prevent insects and fleas do not protect against heartworm disease. 5. The belief that the house protects the animal from disease-causing insects. Some people think that by leaving their animals indoors, you will not be infected with this disease, but unfortunately this is not true, because there are insects that can transmit the infection to infect your pet after that, so you must protect your animal even if it spends all its time at home. 6. Not knowing the appropriate time to dose. Some people are confused about the date of preventive doses, and some are unaware of when the appropriate time for those doses is, and unfortunately the symptoms of this disease do not appear on the pet until the last stage of it.
Let's go.
Symptoms of this disease. Symptoms of the disease include difficulty breathing, coughing, fatigue, decreased appetite, weight loss, vomiting, constipation, lung, liver and kidney disease, or heart failure which may lead to death. Most pets infected with heartworm do not show any symptoms until it reaches its stages. It is therefore necessary to prevent it. Please do not forget to support us by subscribing to the channel.